Erectile dysfunction is one of the most common men's health issues, and yet it's also one of the most misunderstood. For millions of men, ED brings not only frustration in the bedroom, but also shame and silence. And that silence allows myths and misinformation to spread. Some men believe it only happens with age. Others think it's all in their head. Many assume a simple pill will fix it, or worse, they ignore it, hoping it will go away on its own. The problem is, these myths don't just damage confidence, they can delay diagnosis of serious health conditions like heart disease, diabetes, or prostate problems. That's why urologists want men to stop believing the myths and start facing the facts. In this video, we'll bust the most common misconceptions about ED, explain what's really happening inside your body, and show you why the truth could protect not just your performance, but your overall health and even your life. One of the biggest myths about erectile dysfunction is that it only happens to older men. It's true that age increases risk, but ED is not just a problem of aging. It can affect men at any stage of life. In fact, research shows that a significant number of men under 40 experience some form of erectile dysfunction. For younger men, the causes are often different. Stress at work, anxiety, poor sleep, smoking, alcohol, and even pornography overuse can interfere with normal sexual function. Obesity, lack of exercise, and high blood pressure are also major risk factors even in men who are otherwise young and healthy. But here's the most important point. When ED happens early, it can sometimes be a warning sign. Urologists often say that the penis is like a barometer for overall health. Because the blood vessels in the penis are smaller than those in the heart, ED can appear years before heart disease, diabetes, or other vascular problems are diagnosed. So the truth is clear. ED is not just an old man's issue. If you're experiencing it at any age, it deserves attention. A urologist can help identify whether it's lifestyle-related, psychological, or an early sign of something more serious before it becomes a bigger health problem. Another common myth is that if a man can't get an erection, it must all be in his head. While stress and anxiety it can absolutely play a role, the truth is far more complex. Erections depend on a precise chain reaction involving the brain, nerves, blood vessels, and hormones. If any part of that system isn't working properly, erectile dysfunction can occur. Physical conditions like heart disease, diabetes, low testosterone, or prostate problems are often at the root. In fact, urologists estimate that more than half of all ED cases have a physical cause. That said, psychological factors are also important. Stress, depression, relationship tension, and performance anxiety can disrupt the brain's ability to send signals for arousal. This explains why some men can get morning erections or erections during masturbation, but struggle during sex with a partner. Anxiety is interfering, not the body. The key point is this. ED is rarely all in your head or all physical. Often it's a mix of both. That's why a urologist looks at the full picture by testing hormones, circulation, and prostate health, while also considering mental and emotional factors. By separating myth from fact, men can stop blaming themselves and start finding real solutions. One of the most dangerous myths about erectile dysfunction is that a simple pill like Viagra or Cialis will fix everything. While these medications can be very effective, they are not a cure and they don't work for everyone. Here's why. Drugs like PDE5 inhibitors improve blood flow to the penis, but they don't address the root cause of the problem. If your ED is linked to heart disease, diabetes, low testosterone, or prostate issues, a pill may temporarily improve erections while the underlying disease silently progresses. For some men, especially those with severe diabetes, advanced vascular disease, or after prostate surgery, these medications may not work at all. Urologists warn that relying on pills alone can give men a false sense of security. The real solution is a personalized treatment plan, which might include hormone therapy, lifestyle changes, managing chronic conditions, counseling for psychological factors, or even advanced procedures like injections, vacuum devices, or implants. Pills can be part of the journey, but they are never the whole answer. A urologist doesn't just write a prescription, they uncover the cause and design a plan that restores both your sexual health and your overall health. Perhaps the most harmful myth of all is the belief that erectile dysfunction is just a bedroom issue, something that only affects intimacy and nothing more. The truth is, ED is often a warning sign of deeper health problems that extend far beyond sex. Urologists call ED a sentinel symptom, meaning it can be the very first visible sign of diseases like cardiovascular disease, diabetes, or prostate cancer. Here's why. The blood vessels in the penis are much smaller than those in the heart or brain. If plaque is building up in your arteries, you'll likely notice erection problems years before you experience chest pain or a stroke. In this way, ED is sometimes the earliest clue of heart disease. Similarly, men with diabetes often develop ED because high blood sugar damages both the nerves and blood vessels needed for erections. Ignoring ED in these cases means ignoring a disease that could also harm your kidneys, eyes, and overall health. Even prostate problems like enlargement, inflammation, or cancer can affect erections. And sometimes it's not the prostate itself, but the treatments, surgery, radiation, medications that contribute to ED. The message is clear. ED is not just about confidence in the bedroom. It's about your overall health. When men ignore ED or dismiss it as not serious, they risk missing the chance to detect and treat life-threatening conditions early. A urologist sees ED not as an isolated problem, but as a vital clue to a man's total health picture. One of the most common myths men believe is that if they just ignore erectile dysfunction, it will somehow go away on its own. Unfortunately, that's rarely the case. ED is almost always a sign of something deeper, whether it's blood flow problems, hormone imbalance, nerve damage, or psychological stress. Left untreated, those problems usually get worse, not better. For example, if ED is linked to early cardiovascular disease, ignoring it means the arteries may continue to narrow until chest pain, a heart attack, or a stroke occurs. If it's tied to diabetes, uncontrolled blood sugar can cause permanent damage to nerves and blood vessels, making erections even more difficult to achieve. On the psychological side, avoiding the problem often fuels anxiety and relationship stress. What starts as a medical issue can quickly spiral into a cycle of fear, frustration, and loss of confidence. The good news is that when men seek help early, treatments are far more effective. Urologists can identify the cause, tailor therapies, and even reverse some of the damage if intervention comes soon enough. The truth is simple. ED doesn't just disappear. The sooner you take action, the better your results for your health, your confidence, and your future. Men, erectile dysfunction is one of the most common health challenges, and yet it's clouded by myths that keep too many men silent. The truth is clear. ED doesn't happen only to older men. It's not just in your head. It's not solved by one pill, and it's not something to ignore. Most importantly, it's not just a bedroom problem. It's often your body's way of warning you about heart disease, diabetes, hormone imbalances, or prostate issues. A urologist is the doctor trained to cut through the myths and get to the facts. They have the tools to test your blood, check your hormones, evaluate your circulation, and guide you to the right treatment plan. And when ED is treated properly, it's not just about better performance. It's about protecting your long-term health and restoring your confidence. So don't let embarrassment or misinformation hold you back. Don't believe the myths. Believe the science and take action. Make an appointment. Ask the questions. Get the tests. Because your health and your future are worth it.